I didn't know anything about mental illness really. When my son was diagnosed with schizophrenia, I just looked it up in the dictionary. Since my son's death, I've formed a group, an advocacy group for the mental health people. We've got to have doors in the community or a service that can help de-escalate the situation and help these people, because once they become seriously psychotic, they're going to need months and months to recover, and that's costly for the government and taxpayers, and it's very costly on the family, and most importantly it's at a huge cost for that person.
One of the things that we're focused on is keeping people well and out of hospital as much as we can. We know that community-based care is better for people, better for their families, and better for everyone really.
I think we sometimes forget that our patients, our clients live in communities that are very diverse. Mental health is not about specialist mental health services, it's a community endeavour, and it is achieved through the engagement of the community as a whole.
Well over half of all of the people who are taken into police custody struggle with mental illness.
South Melbourne, St Kilda, Paran, Malvern stations, we have one of the largest incidents of mental health related issues in the state.
Well, I'd like to think that it'll help them by providing them access to mental health in the home, instead of them having to be transported to the nearby emergency departments, hospitals for their assessments. It's also been shown that being in your own environment helps the recovery of that person, that their illness isn't as sustained as what it has been in the past.
To get the professionalism of a clinician there right there and then, to triage and assess, to get a fully trained police officer who's well aware of what's going on and trained in communication skills to deal with people with a mental health issue.
There needs to be more education in the community, more relief for carers, more recognition of carers. The carer is riding this journey with them, and it's often a very, very tough one.
The benefits are we're seeing people in their own environment. They're less tense, so you often have family or friends involvement as well as when you're seeing someone in their own home. It's beneficial in two folds. You're not just looking after that person in the community, you're looking after their family and the distress that the family have too. It's better now to find these services that are available for people with mental health issues, that they can actually access them in the community, such as CAT teams, triage service, the MHICU program. MHICU is about positive outcomes for patients in there when we assess them in their home. It's about keeping people safe in our community. So police being involved with clinicians in helping people who shouldn't be in police detention and who need our help is a great way to both help those people and keep the community safe.
I'd like to see this particular unit go Victoria-wide. I'd like to see it go Australia-wide, and it potentially can.
It means that we're not having to find ourselves dealing with the same people day in, day out. They actually get the help they need, their lives get turned around, and we no longer see them in trouble.